And Dr. Guilleminault points that out, that when we have low muscle tone of the oral cavity, that leads to poor suck, swallow, chew patterns, decreased muscle use, and then that leads to decreased jawbone growth, and then we have smaller airways. So the MYO Munchee is a perfect tool to help build muscles, to combat that muscular hypotonia. And when you talked about pacifiers, as a myofunctional therapist, a lot of us feel, or how I was trained, is that we should get babies off of pacifiers between 4 to 6 months of age, because those oral habits are self-soothing, calming, right? So nursing is self-soothing for a baby, but not all babies can be nursing all the time. So the pacifier could be self-soothing or calming for the baby and causes that release of endorphins, serotonin. But between like 4 to 6 months of age, when they can start to wiggle, roll, begin to crawl, they can start calming on their own. And the extended use of a pacifier beyond that time kind of becomes like a chemical addiction. And that's how I was trained. So we want to stop it around that age. And I feel like a child who might be struggling with a pacifier, that's a great substitute, or even a finger sucking habit, is get the MYO Munchee in, and now we're replacing that with a good exerciser, right? How do you tend to use the MYO Munchee with those, like to replace a habit like that?
Yeah, no, it's exactly what it's perfect for, to start bringing it in and minimizing the other, and all going well. The finger sucking habit, what you're looking for is that eventually they have less need for it. And so it's a great tool to be, they're meeting a need with it, aren't they? That's what they're trying to do. They're still needing that self-soothing. So if we can bring those other attributes online, like the chewing, the swallowing, the breathing, in that, and get that tongue really engaged, they've got a much better chance of being able to self-regulate. So yeah, when we talk about it, it's a great transition tool to help transition them off, and really trying to help the parent understand why, because I think some people can be quite concerned that the baby's not going to cope without it.